How do you identify a focal seizure? Imagine witnessing someone suddenly acting differently, but not in a way that affects their whole body. That's often how a focal seizure begins. A focal seizure starts in one specific part of the brain, which causes symptoms that depend on which area is affected. To recognize it, you need to pay close attention to how the person behaves, their awareness, and any physical signs during the event. The key feature of a focal seizure is that it begins in just one part of the brain. Because of this, the symptoms are usually localized. For example, if the seizure starts in the part of the brain controlling movement, the person might have jerking or twitching movements on one side of their body. These movements can involve the face, arm, or leg and may be stiff or limp. Sometimes, muscle twitching is limited to just one muscle group or one side of the body. Focal seizures are also classified based on awareness. If the person remains fully aware and alert during the seizure, it's called a simple focal seizure. They might experience unusual sensations like tingling, numbness, or visual changes such as flashing lights or colors. They can usually remember what happened afterward. But if the seizure affects their awareness, it's called a complex focal seizure. During this, the person might stare blankly, not respond to others, or perform repetitive automatic movements like lip smacking, hand rubbing, or swallowing. They might seem confused or unaware of their surroundings. Symptoms can also involve sensory experiences. The person might feel dizzy, hear strange sounds, see unusual shapes, or smell odd odors. Some might experience emotional changes like sudden fear or feelings of déjà vu. Autonomic symptoms such as sweating, a racing heart, or nausea can occur too. The specific symptoms depend on which part of the brain is involved. Many people experience an aura before a focal seizure. An aura is a brief warning that can include strange tastes or smells, visual distortions, or feelings of fear. It's actually a small focal seizure itself and indicates where the seizure is starting in the brain. Focal seizures usually last less than 2 minutes. Afterward, the person might feel tired, confused, or weak in the affected area. Recognizing these signs helps distinguish focal seizures from other types. When helping someone during a seizure, stay calm, clear the area of dangerous objects, and avoid restraining them. If they have impaired awareness, gently guide them away from hazards and reassure them. Seek medical help if the seizure lasts longer than 5 minutes, if multiple seizures happen without recovery, or if they have trouble breathing or get injured. Understanding these signs and symptoms helps you identify a focal seizure accurately. Remember, each person's experience can be different, so it's always best to encourage medical evaluation for proper diagnosis and treatment. If you see someone having a seizure, your quick and calm response can make a big difference in their safety and well-being. Always consult healthcare professionals for personalized advice and care.